Welcome to Chat with the Lawyer. I'm your host, Walla Blagay, and today I'm honored to have Attorney Earl Adams on our show. He is a celebrity in his right, well known in the community. Actually used to be the Chief of Staff for Lieutenant Governor Anthony Brown at the time during the O'Malley administration, and now he is a partner at Saul Ewing Law Firm, and he's going to give us some insight on healthcare reform. What should we expect? What changes should we expect? And we have an expert here to give us some insight. Welcome.
Thank you so much, Walla. I appreciate it.
All right. So can you tell us about your background? How did you get to the point that you are today?
Well, first, again, thank you for letting me give me the opportunity to be on the show. So I am I'm a blessed, born and raised resident here in Prince George's County. Graduated from the public schools, and upon graduating and returning to the county, I was able to find a job at a large law firm where I practiced for several years, and then made the decision to run for office. I like to say that I didn't lose, I just wasn't successful. But
where did you run again?
I ran for the Maryland House of Delegates in the 26 in 2006, and when a door closes, God opens up a window, and I found myself with the opportunity to work for Anthony Brown, and was honored to work in the O'Malley Brown administration for 5 years. Thereupon leaving, returning to private practice, and since returning to private practice, I've been a regulatory lawyer, helping and guiding companies in heavily regulated spaces. So whether it's in the healthcare space, public utilities, my job is really to help companies navigate their way through the government bureaucracy. So it's rewarding work, and frankly, I can't think of a better time to be a regulatory lawyer than right now with this current administration.
I could not agree more. So let's get into the healthcare reform, because everyone knows Obamacare. Everyone throws the name Obamacare. Of course, there's also Affordable Care Act, which was its regular name. And actually, some people actually don't know what exactly does the Affordable Care Act, or as also known as Obamacare, what does it entail?
Yeah, so the Affordable Care Act, what it effectively did was create a national network of platforms whereby individuals could buy exchanges, is what they're referred to as a national network of exchanges where individuals could purchase health care. Prior to that, the majority of people received health care from their employers. So if you didn't have a job, your only option was Medicaid, which is a federal program designed for people that are either impoverished or that are very old. So there's a very large gap of people that fell into this hole that did not have health insurance. And so what the Affordable Care Act did was it created these exchanges, and it pretty much allowed for these individuals who otherwise maybe they weren't insurable because they had some type of prior pre-existing health condition, or they just did not have the money to be able to go directly to, let's say, a Blue Cross Blue Shield to purchase insurance. What it did was through the exchanges, and depending upon your means, you could get subsidies. And that way, it actually lowered the cost of insurance to make it more available for the average person. As part of the program, it also insurers don't really like two groups. They don't like really the people who are very sick and who are frankly very old, who are more likely to get sick. And so the law actually created sort of certain prohibitions. So an insurer could not kick you off of your insurance if you had a pre-existing condition, or cannot discriminate against you if you had a pre-existing condition. Or if let's say if you're just a very sick person, you had a lot of claims prior to the passing of the Affordable Care Act, you could be kicked off of your insurance. The ACA prevented that from happening. It also allowed for parents to keep their children on their insurance prior to the ACA's passage. Depending upon the health insurance, it could be 18 or it could be 21. The ACA allows for parents to keep their non-working children on their insurance to age 26. So effectively what it did was it tried to narrow the number of Americans who, for whatever reason prior to its passage, did not have health insurance insurance to give them an opportunity to be insured. The policy behind it is simple. We pay for people, whether you have insurance or not. Those of us with insurance still end up paying for it because the people go to emergency rooms. So rather than paying for it through very expensive emergency care, it's better to have people receive the care they need while they're going. It passed. From a political standpoint, it was a very controversial bill, but ultimately it passed Congress and became law. Maryland leaned forward. While serving in the Mallory Brown administration, Maryland was one of the first states to set up an exchange. So the Maryland Connector is what it's called. And it went to work immediately to try to narrow the gap of, at the time, the roughly 400,000 Marylanders who did not have insurance in order to get that number at a more reasonable basis. Right now, like you said, Mr. Trump, he campaigned on a promise of repealing and replacing the Affordable Care Act. And so Congress is in the process now of trying to determine what does this look like.
Well, before we get there, let's ask a question. Let's just say I got let go from my job and I don't have a job anymore and I have health insurance through my job. So I don't have that anymore. I'm 32 years old. I cannot be covered under my parents' health care. I don't qualify for Medicaid or Medicare. How do I get insurance?
Yeah. So right now, the way that an individual that you described gets insurance is that they go to the Maryland Exchange, and it's actually a very user-friendly.
And how would you go to the Maryland Exchange?
It's on in the sense that MarylandExchange.com.
I see. So you can just like
Google
so people should know that.
To help your viewers, yes. No, it is a website. Simply go into Google or your favorite search engine. You put in Maryland Exchange, and the very first link will likely be the state's exchange. And then it's actually, as I was going to say, a very user-friendly site. You put your name in, you put your address, your age, that's the registration process. You verify that registration, and then it's like going to Travelocity. You put in, it just gives you a list of various options. So one option could be United Healthcare, another option would be Blue Cross Blue Shield, and you then decide how much coverage you want. Now, under the ACA, there are certain essential health benefits that have to be covered. So that's everything from, with respect to women, mammograms, for instance. So all of the insurance options that are on the exchange actually include these essential benefits. So an individual just goes, they identify, they decide how much they want to pay, and they click on it. They then have to fill out information about their financial, with their financials, because the ACA also provides for certain subsidies. So if you make some amount over what's considered the national poverty level, you may be eligible for subsidies. And so the exchange actually tells you if you are eligible for subsidies, and you hit accept, and you are then covered as of that day. It's that simple. It's actually a very simple, very direct way of, probably a good example of government providing a great service in a very direct way.
And that's good to know, because I know people who have expressed that they want to get coverage, but they said, should I go to a government office? So it's good for people to know that. Now, what if somebody isn't really computer friendly? Do you know? That's a
great question. And the answer is that there are actually programs through the Maryland Connector. There are 800 numbers that an individual can call and can actually have someone walk them through the actual registration process. So they themselves, they don't have to, if they don't have a computer or access to the internet, they can call the Maryland Exchange, and they're called connectors, the individuals who do it, and they will actually register a person for coverage. Now, I should say that, at the time that we are now taping this, the open enrollment period for Obamacare or the ACA has closed. So an individual that did not sign up prior to January 31st would not be eligible today in order to go onto the website. Now, unless you, and just to kind of use your example, let's say that 32-year-old woman was laid off from her job where she had health care. Well, that's a change of circumstance. She would be eligible to go and to sign up for it. But if you're just an individual who did not have insurance prior to January 31st and you now want to get insurance, you would actually have to wait a year before you could do that.
And just to clarify, if you don't have health insurance for a year and it's required by law, how does that impact you?
So part of the ACA, that's a great question. And it's important to kind of take a step back. One of the ways that the ACA sort of set itself up in order to reduce the price of insurance is that it pretty much created what's called the individual mandate. And what the individual mandate says is that everyone who is otherwise eligible needs to have insurance, because that's the way that we spread out the risk, by having as many people in these pools as possible. And so the way in which it works is that if an individual who otherwise could be insured chooses not to be insured, this past year, well, I guess last week on April the 18th, when they filed their taxes, there was a penalty that they would have to pay as a result of not being insured. And so that is actually a way that, that penalty is designed to, to kind of create an incentive for people to otherwise who would not get insurance to get insurance.
All right. Well, we're going to take a short break. This is really good information, and I know you're getting a lot from it. So please stay tuned. We're going to take a short break, and we'll be right back. Thank you.
Learning is about more than just letters and numbers. Social and Emotional Learning, or SEL, teaches kids how to handle emotions, set goals, and make good decisions. Self-management is the ability to control one's emotions and behaviors in different situations. Teaching children how to define and handle their emotions can help them whenever they feel frustrated or overwhelmed. Try this. Ask children to come up with 3 things that they can do to calm down when having a tough time. Some ideas are counting to 10. Listening to a calming song, or taking some deep breaths. Write them down and put the list where they can see and use it when facing difficult feelings. Parents, caregivers, and teachers can ensure that social and emotional learning is an important part of a child's overall health and well-being. To find out more, visit First Book at firstbook.org/SEL. First Book is a nonprofit organization providing all children with equal access to the books and resources they need to succeed.
Imagine your entire family killed in front of you. You'd be traumatized for life. And so it is for these elephants, victims of the ivory trade. Please, be ivory free, because when the buying stops, the killing can too.
My son had a drinking problem at college. I'm glad a friend suggested Al-Anon family groups. Is someone's drinking troubling you? You might be surprised at what you can learn in an Al-Anon family group from people just like you. Call 1-888-4-AL-ANON or go to alanon.org.
Welcome back to Chat with the Lawyer. I'm here with Attorney Earl Adams, and we're going back into the discussion on healthcare reform. Very, very important information. So let's go into maybe a small business owner. Now, if small business owner, we are in a county that has a lot of talent, a lot of people own their own businesses, and sometimes they're the only person there. They're the only person working for themselves. Now, could they go to the Maryland Exchange, or do they have to go through some sort of process as a business owner?
Yeah, so the ACA, really the only distinction that it makes when it comes to business owners is a requirement to provide insurance for their employees. And depending upon the number of employees you have, that's where the requirement kicks in. So to your example of a solo practitioner, if you will, that individual is not required to provide employer insurance, but they would be able to go to the Maryland Exchange and and sign up for insurance just like anyone else. There was a lot of discussion and debate as to where that number should be, because a small business owner, it's expensive to be able to provide insurance for their employees. And so ultimately, what you'll find with a lot of small businesses is that they will actually encourage their employees in order to go and to sign up with the exchange so that they can be covered.
And also, so they can actually do that. They don't have to bear the burden. The employee,
That's right.
do they have to provide the employees with some sort of payment for their?
No, there's no subsidy that comes from an employer. The subsidies come from the federal government when it's all said and done with. Now that's with a small employer that is, encouraging their employees to go to the health exchange. But now let's take an employer of 100 that has 100 employees. Well, in most instances, traditionally the way it works is that their employer does contribute towards a monthly premium, and the employee contributes, and so that's what turns into the amount that's deducted from one's paycheck for someone who has a full-time job. So there is, and I wouldn't call that a subsidy. It's usually just referred as the employer contribution. That's part of the deal, I guess, employers make with their employees. Will contribute to some of the cost of your health care.
Now, just to clarify, as a small business owner, if you have 10 employees, do you have to provide health care?
No, you do not.
25?
Actually, the number is 50.
50,
employees or more. There's an obligation for that employer to provide insurance. But there are there are exceptions that can be made. And if based on the percentage of the number of employees that you have that are insured, there's a way to make it as flexible as possible for the employer, because the ACA was not intended to close small businesses when it was all said and done with. The hope was to be able to provide coverage to people who otherwise would not have it.
And does the government assist small business owners in getting a good deal with insurance companies?
So you're speaking as to ones that actually have to provide insurance. Right. The ACA did not create any additional sort of, kind of incentives or plans. The hope was, the economics of it all was that because insurers would have more people that they were insured, that would have a sort of a cumulative effect to push down costs in order to make it more affordable to everyone.
And I'm glad you brought that up, because that's not happening. Part of the argument against the ACA is that insurance prices are going up. As somebody who does labor and employment myself, I get calls from insurance companies letting employers know that they're now raising the prices of the premiums. So why is that happening?
To be honest with you, Walla, I think that some really smart people are still scratching their heads trying to understand exactly where the ACA went wrong. It's far from a perfect bill, but effectively, insurers are businesses, and so they want to, as best they can within the confines of the law, to make money. And so, what we had in a few instances in a few states is that the states did not take on sort of. And I don't want to get too much in the weeds into the discussion, but they did not. Certain states did not take on the full responsibility that the ACA provided, and that was expanding Medicaid. And so, as a result, there were not as many people depending upon the state, that actually signed up for health insurance as they originally thought. The penalties themselves are not really that high, are not high enough to create a true incentive for people to go out and to sign up. So as a result, there just aren't as many people as insurers perhaps thought there were going to be. And so given that, the cost of healthcare, whether you're talking about cost of prescription drugs, the cost of medical equipment, those things are still rising. And so the effect is an insurer has to raise its prices in order to be able to cover all of the additional costs that may exist. So it's it was a kind of an unintended consequence of a well-intentioned program was that you now have a situation where insurers say, we're just not making enough money to cover the overall cost that's associated with this program. So as a result, we need to raise premiums. Let me make one political sort of statement. Some of the talk about the increase in premiums is a little overstated, only in the sense that a large percentage of people that received notices in 2016 that their premiums would increase were actually eligible for subsidies. And so the out-of-pocket costs for those individuals really was not going to rise that much, okay? Now, some might say that, hey, if my premium was $100 and now it's going to be $175, well, you know what? In my financial situation, that $75 is a lot of money. That's $75 a month. So believe me, I'm not suggesting that it was that was totally overstated, but it is important to know that the ACA as structured try to account for that very need, and probably more than anything, there is a need to just sort of to go back and to tweak whether it is the penalty. So you make it actually, $2,000, $3,000. Well, that will incentivize someone to go and get insurance. You try to, the federal government should maybe look at sort of controlling the rising costs of prescription drugs. There are many other things that could happen to try to get the program and to get those costs back at a reasonable level.
Now, I remember in 2008, there was a discussion of the public option. And everyone said that the public option was something that President Obama was placing at the table to help lower costs. Having like a public option.
You mean a single payer?
Well, no, the public option. Back in 2008, this is 2009, I do recall there was a discussion of the public option. Public option was going to be almost like a government plan.
Yes. So that's
the point is that doesn't really exist. Do you think that's needed or okay?
So whether you call it the public option, single payer, it is effectively a totally government-run healthcare system. So that is, you're exactly right. Those discussions have always been around. Senator Bernie Sanders is very big on the public option or single payer system. If you look at the rest of
Would that not save us?
So, well, here's the thing. If you look at the rest of the modern, the Western world, they operate on some form of a modified single payer system. I really think that it depends on one's political leanings, whether or not they believe that is the best option or not. I don't necessarily think that the economics sort of economists have determined that this system is better than another system. One would look at, sometimes some criticisms of single payer systems is that the outcomes are not as good, meaning that if everyone is getting the same treatment because the company, hospital or doctor is only going to get paid a certain amount for what they do, well, then they might not sort of give certain treatments that are more expensive. So the health outcome might not be as good. I don't personally believe that, but at the same time, I was perfectly very much on board with the way that the ACA went about, setting up this sort of modified system, which brought as many people as possible into health insurance pools, but then also gave for someone who wants or has the means to pay more, they can go out and they can, get whatever coverage they actually want.
Well, here's the thing: it's the process is still covered by business-run insurance that has interest in making more money. So should there be an option where there's like a Medicaid expansion almost to anyone, just in case the prices of the other insurance are too high?
Well, I always believe that there should be a significant safety net that is available for individuals. And you bring up expanded Medicaid. I mean, that was when I earlier said that some states didn't take on their responsibility. That's exactly what I was talking about. The ACA created a system whereby a state could enlarge its Medicaid population and actually get reimbursed the additional cost by the federal government. In some states, Mississippi, Arkansas, Georgia, chose not to do that. And as a result, there are people that were left out of, effectively fell through what they call the donut hole. They were not otherwise eligible for coverage. So yeah, no, I definitely think that whether you call it an expanded Medicaid or you call it something else, it behooves us all to have individuals with health coverage because we're going to pay for it regardless. But even outside of the money, it's just right that an individual is able to have their basic health needs taken care of.
So, with the likelihood that the Trump administration might once again try to get rid of the ACA, what do you know what the options that they discussed before and was trying to propose and pass? What was that?
Yeah. So basically, what the Republicans in Congress have recommended is removing some of the mandates that the ACA required. So I mentioned those essential health benefits. Effectively, they are saying we need to remove, the mandated coverage, and that by removing that mandated coverage, that will lower costs. They attempted to to actually pass a bill, about maybe 3 weeks ago, and they were unsuccessful, primarily because certain Republicans that are even more conservative said, it still costs too much, and it's effectively creating a mandate program. There is right now the thought that within the next week that they may try to come back and pass another bill. Again, what they're doing is they're just pulling out the essential, what a state has to provide. That's effectively what their recommendation is.
Well, thank you, Earl, for coming on here. We're going to have you come back after all of the rumbles in Congress, and we're going to talk about what happened and whether we're looking at a country that has a different healthcare system. So if anyone wants to contact you, how would they contact you?
They can contact me at eadams@saul.com. That's EADAMS at Saul, SAUL.com.
Well, thank you, Attorney Adams, for coming on our show. If you want to check out more episodes, you can go to www.chatwiththelawyer.tv. Again, www.chatwiththelawyer.tv. And thanks for watching.
One theft every 6.5 minutes. 156 thefts every day. Car thieves appreciate all the help they can get. So here's a shout out to the more than 57,000 drivers who admittedly made it easy for the thieves last year. 57,000 who left the keys in their vehicle and had it stolen. A 22% increase in just a year. Old habits die hard, and thieves can't help themselves, especially when it's so easy. So why is it so difficult for some people to turn off the car, take the key or the fob, and lock it up before they walk away? Turn off the ignition and lock your vehicle every time you get out. Don't leave keys or fobs inside. Put all valuables out of sight in the trunk or take them with you. Lock it before you leave it. Don't make it easy for the thief. If you know something about vehicle theft or insurance fraud, call us at 1-800-TEL-NICB. That's 1-800-TEL-NICB. A public service message from the National Insurance Crime Bureau.
It's a girl. When I was born, my parents were so excited to have a little girl. They spent hours imagining my bright future. Maybe she'll be a rocket scientist when she grows up. If I don't give up in math and science in middle school. She could go to college and earn her advanced degree. As long as my campus is a safe place. She's so talented, she's gonna make big bucks someday. But only if I'm paid fairly for the work I do. Why does being a girl mean having to add words like if and only to my dreams?
With your help, AAUW will change the climate for women and girls.